days, but you pretty much will know which unit it's going to be for the midterm, and then we'll reverse it for the final. So you get exposure practicing on both ones. Because what's happened in the past is that people like their favorite one, and then when they get into the clinic, they don't know how to use it because they've only learned that one. And so the clinic actually has a different one. As we get closer into the clinic, and beginning of semester 8 or in 7, we can do a review again to refresh yourself with our ultrasound. So on the back of each of the units has the power
Oh, my.
on there, so we always want to make sure the power turns on. When we're doing our testing, the power will be off, so just make sure you know where the power unit is. As we go through it, take as many pictures of the unit, so as you're studying, you'll be comfortable with the area. On this particular unit has electrotherapy, this bottom part where my hand is covering, so we're not going to worry about this yet. We're only going to worry about the first part. That screen over there is kind of, it looks like it's a touch screen, but it's not. The knobs, buttons to the side of it is that what actually gets it. We'll practice on that too. For the most part, for ultrasound, time-wise, 8 minutes is good. Sometimes we might do 6 to 8 minutes. 6 maybe in an acute scenario, 8 in a chronic. But pretty much either way, 8 minutes is good for ultrasound. When we get into our other E-stim, 10 minutes is a good time period. You can go a little bit longer. Sometimes it's better with our E-stim to go 15 minutes, 20 minutes. But ultrasound, 8 minutes, no more than 8 minutes is really needed for in regard to ultrasound. Okay? As we look over here, we're going to have our intensity. Intensity, we're going to start off at 0.5 watts per centimeter squared. A lot of our settings here relates to whether it's acute or chronic and how big the tissue we have going on, right? So I might have Haley as a patient, or I might have Dorian as a patient. And so there's different tissue thickness. And so that's a lot of my settings that we're going to think about when we're setting up this particular area. We always use watts per centimeter squared. You'll see watts in that area, but other countries use mainly watts for their settings. Here, we'll use watts per centimeter squared in our particular setting. Here we have 2 centimeter and a 10 centimeter head. I'm sorry, 5. 2 and 5. So this is kind of unique because it has 2 ultrasound heads, 2 and 5. So whenever you're setting up, make sure on this particular unit, you decide which one you're going to use. So how large of a head should I use? Think of this circle or this circle, the area, our effective area, therapeutic range for the patient is going to be 3 times this size. So pretty much the size of a softball or a baseball picture. If it's bigger than that, you probably don't want to use ultrasound. Ultrasound is a deep heating therapy. It's probably one of the only smaller deep heating units we have that we're going to study. And so when we're saying deep heating, well, what does that mean? We can choose either a 1 or 3 megahertz, right? So 1 megahertz is deep, 3 megahertz is superficial.
Oh,
You would think it'd be the other way around,
yeah.
but it's not. 1 megahertz is deep, 3 is superficial. And it has how it penetrates at the speed, and because it's deeper in there, it doesn't penetrate as much. But 1 is deep, 3 is superficial. So think about a tissue with ultrasound. It's going to penetrate roughly about 2.5 centimeters to like 4 centimeters. So roughly about an inch in that area. So as I look at my wrist here, before I hit my bone, do I have at least an inch of tissue?
No.
No, I don't. Right? And so that's why most of the time when we do extremities, we're going to use the 3 megahertz. But it all depends. We might be on his elbow, and so he has enough tissue there that I could actually go up to a 1, because I have at least an inch of tissue for that particular area. Right? So that's all the case. It depends on the patient in front of you, the size, whether it's acute or chronic, will determine a lot of our settings. So you're constantly thinking of that particular area. Right? But pretty much the glute area, the thigh area, the low back, 1 megahertz is good. Wrist, elbow, ankle, foot, pretty much going to be in the 3 megahertz in general. We go for it. Then working my way over here, we have our duty cycle. We have 100%, 50%, 10, 20, and 10%. Think of 100% duty cycle as continuous heat. Whenever you hear somebody say ultrasound, assume 100%. That's what makes it a deep heating massage. I mean, therapeutic, deep heating therapy, not massage, deep heating therapy, right? When we go into 20% duty cycle, that's kind of like a pulse duty cycle, and that would be a non-thermal. So ultrasound can have two things, thermal and non-thermal. What makes it thermal? Setting it at 100%. What can make it non-thermal, non-heat, at 20%. So what conditions do we don't want heat?
Acute.
Acute. So if it's an acute scenario, then you would always hit the 20% because it's acute. You don't want to put heat because we don't want to put more gasoline on the fire, right? Mm-hmm. And so that's what we want. But if it's a chronic, subacute, or chronic, then we can use a deep heat and we can do 100%. You'll see our units will also have 50%, and this one has 10%. That's up to you. Most of the literature will show 20% 100. Boards only focuses on 20% and 100. You can kind of hypothesize. So if I had 50%, is that thermal or non-thermal?
Non-thermal.
Subthermal.
Well, it's 50%. It's 50 heat and 50 not. So people debate on that particular area. So boards will never ask you that question. You as a doctor will determine, I want it on 50% of the time, off 50%. 20% is truly the one for that. Well, if 20% is good non-thermal, then 10% is better. I don't know. The research really doesn't show that as much. It's really the 20% in that area. But you in your practice, every person that sells you these units will kind of tell you, yes, 10% will be better because of blah, 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 blah. But either way, just know 20% and 100% for this course. I won't ask you the 50 or the 10%, so you don't have to worry about that. Those are nuances. When you're in practice, you'll rationalize why you're choosing those particular areas. All right? So always remember again, is my condition acute or chronic? If it's chronic, 100%. If it's acute, 20%. I decide my size of my head. The ultrasound unit doesn't give you the option of choosing to choose, so it is what it is there. Then you're going to decide whether you want it deep or superficial. 1 megahertz is deep, 3 is superficial. Again, depending on the thickness of the tissue that we have. For our purposes here, for our intensity, that will raise this particular area up to 0.5. That's a good setting there. As I went up to 1, 2, 3, depending on the tissue size of the patient, I can go, but it's almost like I'm turning the heat on the fire, and then I'm turning up the flames a little bit higher with this, right? So always be careful with that. If a patient ever feels achiness or in their area, that means you probably burned them, right? So can you burn somebody when they're at 20%? Pretty much, because it's non-thermal. But 100%, and you were doing 1 megahertz, and it was a small area or thickness, then you can actually burn the periosteum, and the comment would be like an achy feeling that the person feels after that. Right? And so when you turn this on, say it's 100%, you're doing deep, say it's the quadriceps area, have a small area you want to do quadriceps. So that you can do 100% and 1 megahertz. And so as you're going through it, you're going to be asking the patient, let me know how it feels. You might feel a slight warming sensation, but that is all. And you really shouldn't even feel a warming sensation. Because you have the ultrasound gel as the medium to conduct the sound waves to penetrate deep into the area. As you're moving it, this actual little friction with the skin is what's making it feel warm. So it's not really a true warming sensation. Those units over there have a little setting of turning it on to warm it up because it's kind of cool. And so you want patients to feel cold. You don't want them to feel cold right away. So those are kind of nice, but it's misleading when you're giving instructions to the patient because then they always want to feel it warm. And the reason why, if I were to put a heat pack on you, but unfortunately it's not working, you would feel that heat intensity right away. This is penetrating deep. You don't have that sensory that deep in the area. So if you're actually feeling it, you're actually burning the area. That make sense? You don't have those types of sensory about an inch into there. You have sensory on the skin area, and when you put the heat pack or you do topical stuff, you'll feel it. But this one, because it's penetrating deep, and if you feel it warm, hot, then that's a little, you could be burning the patient. All right, so let's take a quick little break, come back and you practice some